Okay, so Alex, just introduce yourself in full in a way, and looking forward to your talk. Thank you.
Right, thank you very much, Eva, and thank you for your kind invitation. It's an absolute pleasure to be with you today. Unfortunately, it's not a three-dimensional presence, but I think given the circumstances these days, that's as much as we can get. And yeah, I think you gave me a wonderful introduction. I'm basically, I think my CV is not a great secret, so I think if you're interested more in all the million areas in which I'm trying to occupy myself in clinical psychology, empirical research, I think it's very much available. So I think I'll prefer using our very precious and quite limited time on actually talking about what I was asked to talk about today. And first of all, I'll obviously, I know it's not at all the best recipe for an interactive kind of conversation, but please, I will pause at times and ask some questions. Usually when I ask questions, they are not rhetorical. I actually would like to hear answers. And also, if you have questions in the process, I have pauses, because I'm on one hand very grateful for Eva for kind of asking me to talk about the things I'm talking about. Also, I'm going to deal with an absolutely impossible task, and I think we will all be dealing with an impossible task of covering roughly 100 years of conceptual theory in just under an hour. And every concept we're going to talk about, I normally teach either a short kind of 3 or 4 months course on, or at least 3 or 4 lectures. But today we're gonna I think it's a challenging time, so we're taking new challenges. So I'll take a challenge of trying and convey to you all these things in just under an hour, and I hope you'll be with me in the challenge of actually trying to understand something from what I'll try to talk about. So I'll start sharing my screen, and again, a word of caution, because we're covering the uncoverable in a very short period of time. I will, basically what I'll talk about up until the very last bit will be a little bit, not superficial, but kind of, I will not quote all the study. Basically everything I'm going to talk about is substantiated in empirical research. I will not be bringing as much specific examples of studies and research to substitute what I'm saying. So I'll expect you to kind of to take my word for it in a very unscientific manner. Because what's important is for us to bring all these concepts together to actually look at the empirical research which is available today. So kind of I would not be surveying the empirical research from the 60s, 70s, 80s, 90s. So I'll brisk through it and then bring us to the 2010s, and then we'll dive more into the empirical aspect and move slightly further away from the purely conceptual. And so I'll start sharing my presentation. I hope you can see it. Oh, actually, hold on. I think there's another way of doing this, which I think is better. Yeah, I'm sorry, I'm very new to Microsoft Teams because I'm working pretty much exclusively on Zoom. And but I think I'm managing to upload the presentations into Teams. Yes, it's uploading right now. So while it's uploading, I'll talk you through. Oh, I think it's coming up now. Yeah, can you see the slides? Wonderful, that's great. So I think as I said, we're gonna go on a very long but very brief journey to the contemporary, to the two concepts which are absolutely central to contemporary developmental psychology and developmental psychopathology way of thinking, which we use in empirical research, in clinical practice, in education, and we'll try and trace how these kind of constructs, which are so central to our kind of knowledge and the way our kind of scientific investigation goes today, developed from the early days of classical psychoanalysis, and that's what we're going to start with. So we'll start with the history. We'll cover a few key points from classical psychoanalysis, see how they merged together with the attachment theory, which, as I'm sure many of you would know, was an absolutely central paradigm over the 80s and the 90s. How this concept, in turn, led to the birth of the term mentalizing, which is now, again, very widely used both in clinical, empirical, and educational circles. And finally, we'll finish this journey with the notion of epistemic trust, which, in a sense, not completes, because I hope the journey which we're going to talk about today still continues. It's a very dynamic and continuous, but very much complements and closes quite a few circles in also a very kind of conceptually symbolic way. So I think that's going to be our journey today, and I'll try to leave a little bit of time at the end for questions, discussions, and reflections. So,
Alex, could you please give me a second just to summarize what's the schedule of your lecture in Greek? Yeah, thank you. Ο Άλεξ είναι καλεσμένος σήμερα στο πλαίσιο του Ψυχαναλυτικού Κέντρου, αλλά με empirical evidence στο UCL, όπου έχουν δημιουργήσει ο καθηγητής Πίτερ Φόναγκη, που δεν μπορέσαμε να τον έχουμε μαζί μας, γιατί η πρόσκληση έπρεπε να είναι ένα χρόνο πριν. Ελπίζουμε να τα καταφέρουμε στο τέλος της χρονιάς. Έχει δημιουργήσει μια νέα θεωρία, ψυχαναλυτική, κλασικός ψυχαναλυτής ο ίδιος, και έχει εισάγει δύο νέους όρους, οι οποίοι φαίνεται πια να έχουν κατακλείσει με έναν τρόπο το χώρο των ερευνητών που κάνουν δουλειά ψυχαναλυτική, αλλά όχι τόσο πολύ κλασική ψυχαναλυτική, αλλά με έναν τρόπο πώς φτάνουμε να κάνουμε εργαλεία, έτσι, για κάτι. Θα μας μιλήσει λοιπόν πώς από την κλασική ψυχανάλυση φτάνουμε στην έννοια του δεσμού, στο attachment, και πώς το attachment, αυτοί λοιπόν εκεί, δημιουργούν δύο σημαντικές έννοιες. Το ένα είναι το mentalizing, αυτό είναι η κύρια έννοια, και αργότερα, τώρα δουλεύουν πάνω στο epistemic trust. Σε αυτό το κομμάτι είναι που η δική μας ομάδα, τέλος πάντων, στην ψυχολογία, στην εκπαιδευτική ψυχολογία, συνεργαζόμαστε μαζί τους. Έτσι. Άρα θα μας βάλει λίγο στο θεωρητικό κομμάτι και στη συνέχεια υπάρχει συζήτηση. Ωραία, ευχαριστώ πολύ. Okay, now back to you, sorry. Okay, in English. Yeah, thank you.
Absolutely. Right, so let's start from the beginning. And well, I think every properly historical survey of anything psychoanalytic needs to start with Freud, but let's skip the obvious and start with the second generation, that of Melanie Klein, and think about what I like to call them the lost drives, because of course we all know about the kind of the drive theory and the death drive and the libidinal drive, which Freud postulated in his classical theories, and which been with us for over 100 years, very debated, very angered many people, causes a lot of agreement and disagreement, but actually there are certain drives which seem to be a little bit lost. And historically, the notion of human thinking and human learning somehow seemed a bit less relevant and less central to the classic psychoanalytic theory. Because kind of when historically people were dividing the areas, thinking and learning was kind of attributed to the cognitive and later on cognitive behavioral school of thought, and the psychoanalytic school to kind of appropriated emotion and affect. And this artificial divide, I think, done great many damage to the field of psychology, but I would not talk about this. It's a whole different presentation. But also, it's not entirely correct, because Klein, back in 1928, spoke a great deal about the absolute centrality of the epistemophilic instinct. So essentially a basic drive for knowledge and curiosity about the world. about, which is absolutely, according to her, is central to human development. So essentially we are, because Klein is mostly known for a very kind of gory set of terms about speaking about death, anxiety, dread, persecutory superegos, and splitting, but actually Klein was also very much aware of this basic kind of exploratory drive, which allows us to encounter the world, learn from it, and develop in it. And this theory later on was further developed by Wilfred Bion, who, amongst other great many things he spoke about, described a very key psychic element of what he called K, standing for knowledge, but in a very broad sense of it, which is essentially an element which is also which is very similar to Klein's epistemic drive in some way. It's an element which allows to acquire new knowledge and link psychic elements in our mind, also including kind of the psychic, the information received from the external reality. And at the same time, Bion, as a clinician, he observed everything on the couch. He observed his patients, and he's seen that some patients are very hard to reach. Some patients are not taking use of the therapist's interpretations. They're not making use of the therapy. Something is blocking it. And from this, he moved on to talk about the reversible perspective, which he defined as an extreme case of rigidity of thought. And he spoke about the potential of destruction of knowledge, the deformation of knowledge, the attack on making links. And he called it a minus K. So essentially, it's a failure to think. It's a failure to learn. And much later, Ron Britton, who is still very much with us today, he went back to link Bion's thinking and Klein's, and spoke about how actually this epistemic instinct is absolutely central for life in face of uncertainty. And I think it's very interesting that we are now all living in a period of, I think, radical and extreme uncertainty. And in a sense, the topic of our conversation today, I think, is very current and very relevant to, well, the world in which we're living, and how difficult it is at times of uncertainty, in terms of anxiety, to be able to continue to think, think critically, think creatively, and actually assess our external environment. And, well, I'll throw a little spoiler and use the word mentalize it. Now, while all these processes were taking place in the more kind of mainstream psychoanalytic universe, back in the 60s, another kind of reluctant sibling appeared on stage with another psychoanalyst, John Bowlby, who started developing the attachment theory, which I'm sure will be familiar to many of you. I'll just very quickly talk about what attachment really is, just kind of for us to have a bit of a reminder. So attachment theory postulates that there is an evolutionary basis existing in all mammals and humans as well. That basically it's a behavior which serves to maintain proximity to a selected caregiver at times of stress. Basically, when a young being, creature, mammal, actually not just mammals, because I think we also see this behavior in obviously classically in certain types of birds. When there is experience of stress, the first response of a young organism is to seek the proximity of a grown-up, of a caregiver, to be able to minimize the level of stress and to maximize the chances of survival. At the same time, the instinct of the adult species is to actually protect the younger one, so they would normally respond to this display of stress and will try and protect the young ones from external adversity. And attachment really develops from very early on in infancy, mostly evidenced in very observable through various experimental conditions around the ages of 9 to 7 months, when the infant seeks the proximity of an adult at the times of stranger anxiety. And in humans, there are several types of attachment. One type, which were described in detail by Mary Ainsworth, who established them from an experimental protocol called the strange situation, where she noticed how different children responded differently to attachment stress. Some of them were indeed seeking the support of the adult. They were able to explore and they were able to learn from the environment, and they've experienced a certain discomfort when the mother was leaving, were quite comfortable with a stranger when the mother was present, and were happy when mother was returning. And if you think about the ones of you who might have children, I think it's something we always see when we send our children to kindergartens. So they might be quite reluctant to let us go. They might be quite able to stay and play, and they're happy to see us when we come to pick them up. I think it's a very ordinary way of responding. But then a different behavior was also observed. And I would not go into details of how his behaviors look, but actually behaviors when the children do not respond in this secure way. When children seem to be absolutely seem to dismiss the mother. You're gone and I don't care. When children seem to be angry with mother and rejecting her when she's coming back. All these types of behavior were classified into what's called insecure attachment, and there are several aspects of insecure attachment. Why are we talking about that? Because multiple studies which were conducted throughout the 80s and the 90s established that the quality of this early attachment relationship is implicated pretty much in all future relationships the person will have with caregivers, siblings, partners, friends, one's own children, because we know that attachment patterns are intergenerationally transmitted. Further, there were plenty of studies that showed how attachment is very much implicated how attachment was very much implicated in various forms of psychopathology, and how insecure attachment tends to be one of, especially disorganized, seem to be, for example, one of the greatest predictors for developing a borderline personality disorder. Also, attachment insecurity is implicated in quality of learning, social adaptation, susceptibility to stress, and whatnot. So, while this evidence was piling up and growing around us, one question remained. Okay, so we see that there is this evolutionary mechanism which seems to be absolutely central for the quality of the human development and functioning, but how? What is the mechanism which allows, through which secure attachment allows for all these developmental achievements? And what is the mechanism which creates developmental blocks and, in many cases, contributes to developmental psychopathology and to the development of psychopathology? And now we're coming back from more an ancient history to the more contemporary history and to the new kid on the block. Well, the new kid on the block was newer in the early 90s. Now, he's a very experienced and distinguished and a very dear colleague of mine, Professor Fonagy, who coined, and he would always say that he did not coin this word and that this word was existing before him, but I think the centrality of it was put on center stage by Peter. He coined the term mentalizing. So let's think about what is mentalizing. And let's start with the definition. So mentalizing is a form, and I think actually in this definition it's quite an elegant one, belonging to the earlier days of mentalizing, but I think it still remains one of the most comprehensive ones. So if we look at every single word, I think it all carries a meaning. So first of all, mentalizing is an imaginative activity. It's a mental activity, so it occurs in someone's mind. And what it does is allows us to perceive and interpret human behavior. And when we talk about human behavior, we'll speak a bit more about this later on. It's about the behavior of other humans around us, but also our own behaviors in terms of intentional mental states. What does it mean, intentional mental states? Basically, human behavior always has meaning. And this meaning can be explored in an imaginative and curious way. So the intentional mental states might be one's needs, desires, feelings, beliefs, goals, purposes, and reasons. So mentalizing, as Peter will say, is a new word for an absolutely ancient concept, because essentially this idea of thinking about minds is something which originally was talked about in Aristotelian philosophy, and then kept on coming back in different facets and forms and ways throughout human history. But another word, kind of form in which we can think about mentalizing, another definition, it's the ability to implicitly and explicitly. So essentially, mentalizing can be intentional. We might want to mentalize, but also part of mentalizing happens automatically, outside of our awareness, almost as a form of a developmental instinct. So implicitly and explicitly interpreting the actions of oneself and others as meaningful. So meaningful on the basis of intentional mental states. Again, desires, needs, feelings, and beliefs. So essentially, why did he do this? I have no idea. Why did he do it? For no reason. Why did you do it? I have no idea. This is a form of inability to mentalize. On the contrary, why did you do that? I'm not sure, but I think it's got to do with A, B, C, and D is already a more mentalizing. And actually, why did you do it? I'm not sure, is the facet of the most functional mentalizing, because actually we cannot read the minds of others. And if we think we do, and we know exactly what is happening in the mind of the other, this is yet another form in which mentalization might fail. Now, very quick introduction to the theory of mentalization. So, normal ability to ascribe intentions, meanings to human behavior, ideas that shape interpersonal behavior. So essentially, once I'm able to think about the mind of the other and my own mind and how these minds interact, it allows, or if I fail to do this, it will reasonably have a significant impact on the way I relate to others. So while mentalizing, we would always make reference to emotions, feelings, thoughts, intentions, desires, histories. It shapes our understanding of ourselves and others around us. Absolutely central to all human communications and relationships. And spoiler alert, psychotherapy is a form of communication and a form of human relationship. Teaching is also one. And it really underpins clinical understanding of the therapeutic relationship and therapeutic change. So these are basically another. I'll brisk through it just because we're not really we don't have plenty of time. But these are different definitions which allow us to look at what mentalizing is. Now, the central concept of mentalizing is that internal states are opaque, so they're not gloss, they're not entirely visible. That's what I was talking about earlier. We cannot know exactly what's happening to others, and actually the psychoanalytically minded colleagues would probably also say, also in our own minds, we're not always 100% aware of what we're doing certain things, because, well, that point is for people who kind of use more the notions of dynamic unconscious. So we make inferences about internal states, so we can infer that someone might have done something, but these inferences might be wrong. I might be looking, and again, it's always much easier to demonstrate with a live audience, so I might be looking at someone who is sitting and kind of not really looking at me. I might think, oh my God, I'm boring you to death. And I might be wrong. Maybe you're looking up and just contemplating and thinking about what I've just said. But I will always try and figure out what's going on in the mind of the other. I'll be always curious. And so yeah, so the overarching principle is to take the inquisitive stance. We're interested, inquisitive, and curious. So, and another characteristic of mentalizing, it thinks about how that interpersonal behavior is characterized by an expectation that one's mind might be influenced. So I can influence your mind and you can influence mine. Another, I think, beautiful notion here, it might be surprised. I might be thinking something and I might be completely wrong. And this notion will surprise me. And also, it can be changed, enlightened by learning about the other's mind. And if this definition is not a definition of a good psychotherapy, a good teacher-student relationship, many would say just a good and interested human relationship. I don't know what is. Now, mentalization overlaps with so many constructs because everything I talk about, actually, I'm sure you heard. I'm sure you're not I'm not bringing here a message and something we never ever thought about, because actually, lots of it got to do with empathy, with psychological mindedness, with mindfulness, with affect consciousness. All these notions are very much exist in mentalizing. Mentalizing is basically a tool which allows us to differentiate the different areas while actually bringing it comprehensively together. Furthermore, and it was very hard for me yesterday to kind of delete certain slides, which I really like when I talk about this. There is plenty of neuroimaging research, which, for example, clearly shows that mentalizing the self, so more the kind of empathy, more of the mindfulness and affect consciousness, and mentalizing the other, which is more kind of the empathy side, actually exists in adjacent areas of the brain. So essentially, separating these two into two separate constructs is just neurologically wrong. And this is, again, why we kind of stick to the notion of mentalizing, which allows us for this more integrated view of all these functions, both in terms of research, but also in terms of kind of clinical, social, and personal applications. Now, we spoke about the implications of it in therapy. So it's, if we think about kind of what kind of the mentalization kind of group would argue, that any effective therapy, and actually there are several studies, process studies of different types of therapies, that pretty much all effective therapies, what they got in common, doesn't matter which god we worship. It might be the god of psychoanalysis, the god of cognitive behavioral therapy, of systemic therapy, of gestalt, of human-centered therapy. Essentially, we're dealing with one mind, one person, We don't have different parts in our brains, and this is the part which is in charge of receiving cognitive behavioral therapy, and this is the part which is in charge of the deep analytic interpretations. We're dealing with one human entity, and what seems to be in common in pretty much all effective therapies, in addition to the ability to form an alliance, which we'll get back to a little bit later, is actually the capacity of the therapist to mentalize and the capacity of the patient to become able to be able to mentalize his world. Because if we think about it, if someone is unable to mentalize himself and others around them, they are not able to benefit from therapy. They're not able to properly function in interpersonal situations. So in a sense, a prerequisite, let's put it this way, for a successful therapy is the capacity of the patient to mentalize. So if I can mentalize, then I can access the benefits of different types of therapy. And again, very basic example, mentalizing one's kind of emotions and thoughts. If you can't do that, you cannot have a thought diary in CBT. You don't have access to your thoughts. You don't have access to your emotions. How would you be able to diarize that? But we often, for example, see it with, in the more extreme way, with people on the autistic spectrum. You would ask them, so what were you thinking at the time? And they sometimes would say, oh, I don't know. Obviously, you cannot think about your early developmental experiences and how those influence your current relationships like we would do in psychoanalysis without the capacity to mentalize. But I think that's kind of, this point is hopefully quite clear. And so we already spoke, so this slide is really about just layering a little bit how different aspects of mentalizing kind of where they live in our brains. And it's just a few kind of snippets from the neuroimaging studies, but let's kind of won't linger on that because that would take us another couple of hours just to go through this one slide. Now, at this point, let's link, because we started talking, so where were we again? We were in classic psychoanalytic theory. We spoke about, and so we spoke about kind of, let's remind ourselves of Dion, who was talking about the plus K minus K. In many ways, it's one of the ways to describe mentalizing, or lack of mentalizing. And it in a very kind of different language, but essentially we're talking about a very similar concept here. But what's the role of attachment? So what we know is that once our attachment system is activated, and I think it's very intuitive, when we are in stress, we are not great thinkers. When we have attachment stress, again, we are not great thinkers. We cannot, like, if you're dreading and you're in a state of panic, it's not a state in which you're like, I wonder what's going in my mind and what might be going on in the mind of the other. If you're being, God forbid, attacked on the street, you probably will not spend much time on mentalizing your attacker. You'll probably have a very different experience. So essentially, a constant state of attachment anxiety, attachment arousal, stops people from mentalizing. And in some people are found in a constant state or near constant state of attachment arousal, meaning that most of the time their mentalizing capacities are not functioning and they are basically failing to mentalize. And the most classic and really kind of diagnosis which gave rise to thinking of mentalizing is the diagnosis of borderline personality disorder. So essentially it's, and we've mentioned it before, disorganized attachment, which is basically characteristics of the vast majority of people with that disorder, is preventing them from being able to mentalize themselves and others, and gives rise to all the array of symptomatology which we find in BPD. And as current research seems to show, actually it's really the case for most personality disorders, not just BPD exclusively. Now, just a few examples of what non-mentalizing might look like. Well, it's kind of excessive detail to the exclusion of motivations. So I'll also, kind of a patient who struggles to mentalize will give you all the details, where they were, what they were doing, what was the weather, what this person, but will absolutely exclude the motivations, the feelings, and the thoughts of the players. So we will have a set, but with no actors. Focus on external social factors such as kind of school, council, neighbors. Basically, it's all in the other, never in the self, another kind of facet of non-mentalizing. Focus on physical and structural labels. Let's kind of quickly move from it, because that's basically, I think we've all got the rough notion of mentalizing and how it's linked to attachment. So we've already spoke about, so when we bring those worlds, kind of the worlds together, we see that kind of mentalizing and attachment really kind of gives us a new light on the notions of K and minus K, so the ability to know, think, and link. But let's go back and remember there was this epistemophilic instinct Klein and Ron Britton were talking about. Where is that in this equation? So we spoke about the knowledge and the mind, but where is the learning? Where is social learning? And what is the role of learning in all that? And let's also ask why working with some patients is so challenging. So, okay, we know they can't mentalize, but why won't we teach them? Why is that difficult? Because we know that it's, and I think for the clinicians among us, it's very easy, because we all have, okay, we have these clinicians, we have our patients who kind of, they come, but they don't seem to learn. We give them our wonderful interpretations, we give them our wonderful tools, but something makes them kind of hard to reach. So now I'll ask a quick question. What are these? I promise that the questions will never be rhetorical. It's an actual, genuine question. So, what do we see?
It says broken stones or
some fossils.
Yes, some fossils, some broken. Are they like randomly? Let's look at them.
Teeth, tooth.
Yeah. Did someone say tools?
No, teeth, not tools.
Oh, yeah.
That's it. There are tools.
Absolutely. Yeah. These are tools. And why am I showing you tools? These are very kind of, these are all archaeological findings of early kind of very, very ancient tools. And tools are actually one of the evolutionary achievements of humanity. Not just tools, because we know that there are some species which are able to take a stick and use it as a tool. The exclusive aspect of the human kind of, and the human society, is that we make tools which allow us to make other tools. So, and in a sense, a huge part, and this is kind of, there is a huge body of writing about this by Tomasello from Max Planck Institute, who really talks about how this kind of, one of the central kind of tools of human evolution is that we are able to teach the next generation about how to create tools that create other tools. And it obviously starts with those very primitive tools we look at in this picture, moving on to, to all the advancements of civilization, of our mobile phones, computers, which require very complicated systems of tools which create other tools, which create other tools. And essentially that kind of this focus creates and allows for a great kind of for the achievements that humanity has got to. Now, what evolutionary human beings also clearly needed some sort of a universal mechanism of cultural transmission. How do we teach people? How do we enable everybody to get all these tools? So one of the features is language, kind of the use of tools and social systems. So when we think about we need to convey to a young person who is coming into the world a huge amount of information. And this person, this young person, will need to somehow learn this information. They might learn this through content or through the authority of the source who is teaching. So imagine yourself a young person who, how do we learn from content? Content. So it's very hard because it's about deductive learning. So we start analyzing how consistent this information we're receiving to our beliefs, or inductively, how does it kind of works in accordance to principles of theoretical rationality. Content-based learning is a very high order learning, which is hard and takes a lot of time. And actually, if we think about children under 5, they often are unable to do it. Very broadly speaking. But actually, there's a very simple tool to learn, a simple way to learn. I will take this information because I trust you. I don't need to check it. I know that I trust you because you're a benign enough parent, and I'll just take it because it's come from you. And if we think about the amount of questions children ask their parents, the parents are answering, and the children start believing, okay, this is the world. This is what it's worth. Essentially, this barrierless, open way of learning through authority is what we call the capacity for epistemic trust. So the source of the teacher is known, remembered, and judged to be reliable and trustworthy. And we also interpret that the information we get from this source is generally correct about, our society and our community. So if we know that it's nice to say thank you and please, I will not go and say, okay, now I come to school. Do I need to say thank you and please here? I come to meet my friend. Will I say thank you and please here? You generally figure out that, okay, kind of when someone is doing something, doesn't matter where, it's a nice idea to say thank you and please. And that's obviously on a very basic level. At the same time, for any type of information coming from any sort of human being, then the amount of bad information we can receive, irrelevant information we can receive, is also massive. So somehow in this evolutionary mechanism, we need to have a switch which says learn from this person, do not learn from that person. So, and this why we need epistemic vigilance. And what is thought about that actually the basic state of the human being is epistemic vigilance. So essentially imagine yourself, we have a closed door, which is usually closed because there's huge amounts of information coming from different areas of kind of the social world. But then we need to have a system of signals, which gives us open sesame. The doors are opening and the information is coming through. Then it closes and remains closed. And the way it's done, the way we kind of open these doors is through ostensive cues. What is in common in all ostensive cues is A, the person is recognized as a self. And the person is paid special attention to as an agent. So basically, I notice you, I'm talking to you, about you. So it's absolutely, and this is the point in our talk when I really hate the fact that we don't really see each other and the fact that we are on the screen. Because normally I would actually approach someone, look at them, if I know a name. Oh, actually I could do this. So, Eva, I can actually both see you and know you. So, Eva, I want to tell you something today about the way epistemic trust is formed. And I do think it's a very important and quite central concept, which will be very relevant for you and your research group. In a slightly clumsy online way, I've tried sending Eva a huge amount of ostensive cues. I called her by name. I've tried making some sort of an eye contact, almost. I've clearly indicated that the information I'm about to give is relevant to her. It's not generally kind of, oh, by the way. So all these are, I've clearly kind of, and I hope that Eva felt recognized as a self, noticed as an agent, and from there on, whatever information is coming from me is likely to be trusted a little bit more. So essentially, epistemic trust allows us this access to this epistemic superhighway, which, so what's epistemic trust? Is a state evoked by figures of authority. It replaces the default state of epistemic vigilance, allows for social learning in a changing cultural context. It's triggered by these communication signals, ostensive cues. It's opening the channel to receive knowledge about social and personally relevant world, i.e. culture. It allows to go beyond the specific experience. So it's not just, the information is not context specific, it's used broadly and can be replicated in many settings. And so, and that really triggers this evolutionary protected epistemic channel for acquiring knowledge. At this point, everybody who is a bit more empirically oriented says, great, Alex, Peter, UCL group, it all sounds wonderful. How can you prove it? So at this point, I'll go to the slightly more empirical side and I'll try to illustrate it by, I think, one of the studies, which I think is one of the most kind of elegantly designed. This study is a bit old, it was replicated since, but I think it's kind of, it's the one which really shows what I'm talking about. So, experimental illustration of ostensive cues. We had 4 groups of 18 months old children. And these children were shown 2 toys, one orange and one blue. I want to prepare everybody to, the ones who want to kind of answer questions, to switch on microphones because questions will follow right now. And the baseline was an experimenter came to the children and asked for an object. Which object do you think the child gave the experimenter, the blue or the orange?
None.
None, okay. Any other ideas?
The blue.
Why?
I don't know. I just like the color better.
Yeah, it's just like a nicer, friendlier color and shape, you think?
Yes, and I think the children might like it better. May be more attractive. I don't know how to put it.
Thank you. Anyone thinks that the orange one is more likely? No, nobody.
Yes, I can say the orange one.
Yeah.
I think that something to do with the evolutionary base or something you said before, I think.
Okay, thank you. It's like now the people in the study design had we actually, there was a very similar conversation, but it was a trick question, because actually, if you look at it, it's a baseline, and we're talking about a control group. So actually, until all the objects were absolutely the same for the children, they kept on being replaced, because actually we were not studying whether children prefer blue or orange toys. We wanted the toys to be roughly 50-50. So actually, at the baseline, when the experimenter came and asked for a toy, actually, interestingly enough, I think with the exception of 1 or 2 children in the entire study, so children did give a toy to the experimenter randomly. And now let's think about the experimental condition number 1. So, experimenter comes, looks at the child, smiles, and says, "Hello, baby. Hello, baby. Hello, baby." And then looks and smiles at the blue toy and frowns at the orange toy. And then a different person comes and asks for a toy. Which toy do you think the children were likely to give to the stranger, to the new person?
The blue one, of course.
We assume, and it is correct, 71% of the cases, the blue toy, the child gave the blue toy to a different person. So what is happening here? What we're assuming is what's happening here. So the experimenter came, sent some ostensive cues by smiling, making an eye contact, and saying hello, 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 and then taught the child that blue toys are better than orange toys. And the child, from the look of it, was able to replicate this knowledge with a stranger by generally thinking that now these children would believe that blue toys are better than orange toys. But now, so we think generalization took place. But now let's see if it actually stands. An experimenter comes, does not make eye contact, doesn't say the hello baby, and doesn't smile. Sits in front of the child, smiles at one, frowns at other. A stranger comes and asks for the toy. In this condition, condition number 2, which toy do you think the children are giving the other person?
It's more likely to give the blue toy. But in the total, it will have a smaller percentage. That's not 71, but smaller.
Mm-hmm. So we think that maybe they still learn something, but less effectively. I think that's the logic you are kind of suggesting. Well, no, unfortunately. Actually, there's not statistically reliable, it's random, and there are other studies which actually show that there's a slight preference to the orange toy. So the children did not learn the information at all that the blue toys are better without ostensive cues. But maybe they just didn't learn at all. So the third condition, the demonstrator comes, no ostensive cues, no smile, no names, nothing. Smiles at blue, frowns at orange, and then the same person is asking for the toy. Which toy do we think the children give them? It's okay to guess. So guess to guess wrong as well.
I think the blue one, because they try to make her happy because she's beautiful after all.
Absolutely. So essentially, the child is not stupid. It's like, you like the blue toy, take the blue toy. So the specific knowledge happened. So this child learned that this particular lady prefers the blue toy. You like it, you have it. But this knowledge was not generalized. So this, I think, really is a very kind of elegant illustration of how the epistemic how ostensive cues actually work and how this epistemic process takes place. Now we're coming to the end of our time. I had another 40 slides here, which I kind of assumed that won't have time to cover. But in a nutshell, what those slides were about, that in the source of most psychopathology, let me just actually stop the screen sharing so we'll be able to see each other. Right, so just to kind of wrap it up, in what we see now and where we're going with it, that the source of the vast majority of psychopathology is failure to socially learn, because people are found in a state of constant epistemic vigilance and they don't absorb the information from the external environment. So essentially, there is actually, I think there is one slide I do want to show you. I couldn't stop because actually it's a slide which would link. I'll just show it here so it's quickly accessible. Can you see that? So it's just, let's link it with mentalizing. So mentalization is not only achieving secure attachment, it also, if I'm able to mentalize my child, it means that I can send them ostensive cues. So it gives me, the parent, the status of authority to teach my child about the world. So parental mentalization capacity enables them to be significantly more capable of generating appropriate ostensive cues. So I can mentalize you, I can send you ostensive cues, and to keep the gate to learn open. So mentalization is the means through which epistemic trust is established. So I need to mentalize to then, okay, you can stop now. So yeah, so I need to mentalize to then allow the person to learn, and if a person can learn, they're likely to be, broadly speaking, okay, because they will keep on picking information from the world about themselves, about others, about adaptive ways of behavior, etc. But if a child is, for example, is being raised in a situation or being educated in an environment where the teacher, the parent, or the therapist is not able to mentalize them and open the epistemic channel, they will not learn. They will stay in a state of epistemic hypervigilance and will grow further and further and further apart. And what I'd like to kind of finish with here, just to illustrate how that I think that epistemic trust is really, if there's one thing we all need to explore and study now, is that in all the directions, both I think the educational psychologists among us and the clinicians and the empiricists, is that process. Because until we're able to open this channel and until we're able to get someone to learn socially, we cannot inflict any difference. Because we can see our patients or teach our students for years and they will not be able to make use of that knowledge outside of our clinic or outside of our classrooms. And the final illustration I wanted to give is a patient of mine with whom I was working for just over 2.5 years, mostly kind of mentalization-based intervention. And I think she gave one of the most beautiful. She never studied Mentalizing Epistemic Trust and never read any of our papers. But she, towards the end of our work, she said, you know, when we started, I felt that there was a huge layer, very thick layer of glass between myself and the world. I couldn't really see what was going on there. And as we went on, I felt that this glass was getting narrow and narrower and narrower. And now I can actually see what other people are doing. And I understand that I'm not wrong. If I'm doing something wrong, I notice it. If I feel I'm terrible, I compare myself to others and I understand that maybe I'm not as terrible as I thought. So, and I think this kind of idea of thinning this layer and being able to see, it's a great example of social learning. It's a great example of how when we actually notice the environment around us and able to mentalize it, actually it's helping us a lot as, you know, human beings, teachers, educators, therapists. And that's all I think I wanted to know. As I said before, I wanted to talk to you about great many things, but that's the basics I wanted to cover today. So thank you very much. And if we have some time for questions, I'm very happy to take them.
Okay, thank you so much. Thank you. Great. Great, Alex. Thanks a lot. Yeah, actually, just a question. Is there, what is the most popular experiment you have run so far in terms of developing the idea of mentalization? Have you got any of that on your slides with you?
Sorry, which most popular experiments illustrating what again?
Illustrating or developing the idea of mentalization out of it. Which is the most popular one you usually use when you work with children on mentalizing. You presented one experiment right now, okay? So I'm wondering whether there are others as well. In terms of methodology. Yeah.
In terms of the methodology, yeah. I see. So I think it's in terms of because I think, you know, the different, especially when we talk about developmentally, I think the most I would say that one of the most elegant experiments of epistemic trust specifically, because actually this experiment gives us nothing about mentalizing. It's purely about ostensive cues and epistemic trust. Okay. About mentalizing and attachment, there is. Again, it's more of an attachment one, but I think it's very kind of intimately connected to mentalizing. It's an experiment by Corview from 2009 when they look about, it's about how learning from parents versus strangers is affected by the attachment quality. So essentially, it's kind of, that would be one. In terms of the capacity of the child to mentalize purely, without an aspect of learning, I think there are actually several tasks which are great. They are very much similar to the kind of the classic theory of mind ones. So when we show generally kind of unclear picture, similar to maybe you know the adult attachment projective, and you actually ask the child to tell you what's going on in this picture. So there is an interaction of people and what's happening there. So that's a very good trigger for mentalizing, because sometimes children will say, I can't see their faces, I don't know. Sometimes they say, again, beautiful example of it, and again, it's a very nice, okay, you've triggered me into great many of those. There's also a coding system for the thematic perception test, the TAT, which is actually kind of, it's an object relational one, but it has a mentalization aspect. So it's kind of based from the narrative of the TAT, you decode the mentalization capacity of the child. And there's also a similar protocol applied for early memory tests. So you ask about earlier memories, and from the narrative you decode few variables, but the capacity to mentalize and figure out social construct is also very much.
So
May I?
Sure,
yes,
of course.
Of course. There is a hand over there. So if you want to use it to ask a question, this will work perfect for us, right? Okay, Katerina first. Yeah.
Thank you very much. Thank you for this excellent speech. It was a trigger for me. May I ask you if you accept the position that in this social learning we follow a process from externalization to internalization?
Could you say a little bit more? Could you give me an example of what you have in mind?
I have in mind the Vygotskian theory, Engestrom's theory, and all this process from external to internal.
Mm-hmm. So, of course, I think essentially, like if we're thinking about kind of the notion of, I think zone of proximal development is actually one of the beautiful ways of explaining it. It's a great illustration of epistemic trust, because in a sense, once I'm able to mentalize the learner, come with them in, that's basically, I think, it's epistemic trust and explains us what enables the zone of proximal development. Essentially, because we never knew up until recently how it works. We know it works. There's all the classical Vygotskian experiments. But actually, I think that's the explanation, because I'm able to mentalize you and then lend you part of my mind to make a progress. And I think it's also very true for psychotherapy as well, because the patient cannot get to certain places on their own. But once we have an alliance and once we have epistemic trust, they're able to use the mind of the therapist in order to make progress. So of course, right? So yeah, it's a very long way of saying yes, of course.
Thank you very much.
Thank you, Alex. So Irene?
Yes, thank you.
Good.
Yes, thank you. I would like to ask, thank you very much for your presentation. It was great. But I would like to ask, what do you think would be the results in the educational outputs for students because of e-learning due to COVID-19, such as epistemic trust is hard to be achieved? Thank you.
Yeah. Well, thank you for that question, because this is what I was talking about for the last 7 months, pretty much non-stop. So I come prepared. And well, first of all, again, the brief answer is unless, especially kind of thought about, absolutely terrible and devastating. Because we have a huge program now of teaching teachers to work online, because like teaching online, it's not just let's do offline online, it's a whole different story. And one of the modules which I teach is specifically epistemic trust in online teaching. And I'll give something, a critical element. One of the things I very much strongly recommend people not to use in online teaching is Microsoft Teams, because the platform is incredibly, and we could see it today, because the platform is very much unfriendly when you want to see people. And again, I get no money from Zoom, so it's a clinical. I think in this sense, Zoom is a far better platform because it allows you to see large groups of people and your presentation. Because what I was really struggling with today, that I was seeing my presentation, which I don't need to see. I could have a little, but I know what I'm talking about. You need to see it, but I couldn't see you. I could see kind of couple of you at the bottom. So that's why I couldn't send those kinds of cues. Because now, for example, Irene, when you came and like now I can see you, I can see your name. And normally when I teach on Zoom, I actually do quite a lot of it. I use names. I'm looking, for example, classic ostensive cues would be, so Irene, I also think that you have beautiful weather in the background. Like at least at least you have a large window. Wow, yes. So not as great there. So again,
here's Greece, so you are invited. Please come.
Oh, I would love to. I would I also have to give. I love Greece and I love coming there, so I've been kind of missing it. But again, it's also this kind of noticing the background of the person, noticing them, noticing their questions, that enables you to send ostensive cues. And actually, you could, in times of COVID-19, when we teach, we could and should pay a special attention to teaching with epistemic trust in minds. And unfortunately, great many people don't know that and don't know the tools. And I think it's a combination of technical training, because the training, the trainings we've developed is actually a combination of technical training, how to use the platform, and also how to use yourself in order to kind of bring back this lost aspect of epistemic trust, because without it, we are running into a problem of not really teaching. To teach people something which will be only context specific.
Okay, Alex, then if let's say we are trying to summarize in a way your answer about the COVID and online learning. What's your suggestion at the end of the day? I mean,
no, my suggestion was always be make sure to look, I think it's way more important for you to look at your students and for them to look at you, rather for all the parties involved to look at slides, as beautiful as they can be. And I know I did not illustrate this at all today, and that's why I've kind of, when Emma told me that it's going to be on Microsoft Teams, I was like, but I think really anything you can do in order to actually have, I don't know, send them slides before the lecture and get them to flick with them through. The more you can do face-to-face interactions, again, reciprocity, questions and answers, the fact that you are there and you're waiting for them, again, mentalizing, you're interested in their minds. So when I'm asking a question, I'm showing that I actually care about the people who sit in front of me. It's not that I'm just kind of a talking head, talking at someone about something, because it's not evoking epistemic trust. So I think everything you can do to send as many ostensive cues as possible by, again, name use, eye contact, noticing backgrounds, bringing provocative questions, being curious in their answers, responding to their answers with your own answers. So as much of that as possible is, I think, the best way to kind of counteract the impact of COVID and online teaching. And it's very possible. It's just kind of something we need to do.
Yes, the thing is that as teachers, sometimes we have the feeling that we have to teach the students we already met in the past. We have the feeling that things will work pretty easily if we have to do with students we already know and to feel familiar with, and okay, this will be easier. However, anyway, from my perspective, at the end of the day, the issue of contact, the reciprocity and interaction is always there. I mean, we cannot easily get rid of it, even if we work with students who we have met before. All right, so from my perspective, it is quite important to make clear all the time that we make sure that we have a sort of interaction, even if we work with our students, and not only with newcomers. So it's not like a recipe. What works better in a sense if you work with new students or with students you have already met before. It's always a matter of interaction and of what makes us as human beings, right, in a way. So I don't know if there are questions. I have a couple of quite theoretical questions. If there are any questions, we can take them now. Έχετε κάποιες ερωτήσεις που θα μπορούσαμε, έστω και στα ελληνικά. Sorry for my Greek. I'm just asking for questions to be put in Greek and then translate them in English.
Ευαγγελία,
Could I ask a question which would be more or less theoretical concerning the, I would say, the ontological, so to speak, status of interaction, online interaction. Now, in philosophy, we say that intersubjectivity has always to do with embodiment, different types of embodiment with the embodied self. Whereas in online teaching, and this is for decades a question in philosophy of technology, online teaching is disembodied. Okay. What is your perception of this disembodied kind of interaction? Do you feel that it really alters the way people interact, or it's just irrelevant? It's a question of technical skills, or the way we are or we are not familiarized with online teaching. I mean, if we get more familiarized with it, we can overcome the problems of disembodiment.
It's a fascinating question, and thank you for that. It's just absolute, because I think you hit it on the nail. I'll give a slightly complicated, I think it's a complicated question, so I'll give a complicated answer. I do think, and again, being a psychoanalytically trained clinician, I'm very much subscribing to the Freud's classical quote that the ego is most and foremost is a bodily ego. So in a sense, replacing the embodiment and ignoring the body is absurd. Say, pretending that it's the same, no, it's not. It's not the same, it cannot be the same. So, and I think it's very true for psychotherapy, it's very true for teaching, it's very true for any human encounter. I think, again, the amount of, and again, I think from the more of an evolutionary perspective, the amount of senses and sensors which are being triggered in human beings in the proximity of the other cannot be replicated, doesn't matter what technology we use. There is something very, as you said, fundamentally bodily, sensory, kind of, which, you know, even the 6 or 7 months of COVID cannot just erase hundreds of thousands of years of evolution. But I do think that not the same is not necessarily useless. I also think that not the same is not necessarily meaningful. Even more so, I would say not the same, it's not necessarily even worse. Because I must say that, and again, I'm lecturing and teaching, but I'm preliminary a therapist and a researcher and secondary a teacher. But as a therapist, I've been working with people online since 2015, so far earlier, and I find that some of my most effective cases as a clinician were through an online therapy. But what I also keep on saying when I kind of talk to people about this, with the vast majority of these people, and I think that's the question of, and it links to what Eva was talking about people that we know. It's people with whom I originally met.
Already had a physical contact. I mean, you already knew them, okay?
Exactly. I knew them from outside, like I met them once or twice. Not many times, but kind of offline. And then the transition online is much, much smoother. And actually, you know, sometimes, and for many of these people, they would either not get therapy at all, or they will get therapy on Skype or Zoom. And I think here it's very obvious that both, like, something is better than nothing. Also, I think the ability to reach out both in terms of teaching, because again, I think our encounter today is a great example of it. Because you know what? Would we be able to have this encounter in the pre-COVID times? Maybe we would, maybe we wouldn't. And I'm very glad that we're having this conversation now, partially because of it. And would I prefer having all of us sitting in the lecture hall? Yes, of course. But so I think we cannot give up on the embody this kind of aspect of learning, but we can also, with the use of technology and with the adaptation, to minimize it, and in some cases to actually get the benefits of it.
Thank you. Thank you so much.
What's the time? All right, we have 3 or 4 more minutes for question, 1 more answer. No, I have 2 short theoretical questions. Okay, I'll be quick. I'm wondering what's the point where Daniel Stern's theory about the scheme of being with the other meets the idea.
Sorry, Eva, you're breaking. Daniel Stern theory about?
The scheme of a way of being with the other. Right? So what's the point that the idea of subjectivity, which comes from this tradition, right, it gets into your research, into your tradition on mentalizing and now on epistemic transformation onwards?
Oh, I think it's very that's I think that's an easy one. I generally, and again, me and Eva were we started talking, started working a little bit together recently, so I would not surprise you by the fact that I'm not an orthodox kind of thinker in any particular one theory. I love Daniel Stern. I think he's one of the most brilliant developmental researchers of the recent 50 years. But for me, I don't really see a substantial difference between that notion of schema of being with the other and the internal working model in attachment. I also, and again, I know I'm I know I appear as if I'm simplifying everything, and I do to an extent, but I also don't see a huge difference between these 2 terms and the term of internal object relations.
All right.
I think essentially we're talking about the same kind of phenomena with facets, elements. And if we would be in a theoretical seminar, I could speak for hours how different they are. But I think in terms of research, what I'm interested in is how similar they are.
Good. All right. And so I've seen a lot of your work is on borderline personality disorder. So I'm wondering why this sort of particular interest in this particular disorder in one way or another?
I think it's an intergenerational transmission of attachment, because I started working with Peter Fonagy many years ago, and he really ignited my interest in that area, and so I think it's so it's coming from my scientific parents.
Okay, good. All right.
But generally, I also think it's an absolutely fascinating mental health condition, which I think I'm generally interested in human relationships, and in all sorts of shapes, in, again, clinically, educationally, interpersonally, and essentially with borderline personality disorder, it's exactly that capacity which seems to be damaged and compromised the most for these people. So in a sense, it's like Mark Solms, who is working with lesions, and he thinks, okay, the way you see breakouts in the psychic process is when a part of a brain is missing for someone. And I know it's an extreme analogy, but in borderline personality disorder, in the extreme of it, this absolute absence of mentalizing and the capacity to coherently relate is so pronounced that it really allows you to see the phenomena so clearly.
Right. Great. Thank you. If we don't have any more questions, we can go ahead with 2 short presentations of our PhDs.
Just maybe one last thing, because it just triggered because the questions about the teaching, which I hear you, and because we're also dealing with the same things in both Anna Freud Center and UCL, I would really recommend to conduct a training webinar, because what I've been doing for the last God knows how long in different universities, we've been conducting webinars for lecturers and course conveyors on how to teach online.
Sorry,
in general, about about epistemic trust, ostensive cues, just to give people, because so many people, so many of our professors, even the most senior ones, again, we never had this experience, and we see people who were terrific in the audience, and they're terrible online. And actually, kind of giving the basic sets of tools, both technologically and kind of methodologically, on how to do it, can change the way they feel about their teaching. It can change the way the students perceive it. So I think it's a kind of worthwhile kind of investment of time. And yeah, that's the last thing.
Yeah, thank you. It is quite important because, you know, there are a lot of questions. Actually, there is always a discussion and alive, and it is still alive, about how to deal with this situation nowadays about, you know, teaching in a COVID